background for this trial is the fact that we know since 2010 that the addition of Trastuzumab to chemotherapy improves overall survival in patients with HER2 positive metastatic gastric cancer. And since that time, we have a drug which is cheap and well tolerated. We have a target, and we don't use it in patients who can be cured. So I thought that this is something that needs to be changed. For this reason, we designed the innovation trial, which was a randomized open-label phase 2 trial with 3 treatment arms, 1 arm with chemotherapy alone, 1 arm with chemotherapy and Trastuzumab, 1 arm with chemotherapy and Trastuzumab and Pertuzumab. The chemotherapy backbone at the beginning of the trial was cisplatin and fluoropyridine, and after publication of the FLOT trial, this was changed to the FLOT regimen in patients who we thought will be able to support FLOT. Other patients could be treated either with FOLFOX or with CAPAX plus the antibodies. And the antibodies were continued after the end of the chemotherapy for a total of 1 year. So major pathologic response rate was the primary endpoint of this trial, and it was designed to observe a 20% improvement in major pathologic response rate in one of the experimental arms. So the results of this trial showed that yes, there is a clear improvement in major pathologic response rate in those patients in whom Trastuzumab was added to chemotherapy. So there's really one trial arm which stands out when looking at the major pathologic response rate. These are the patients treated with FLOT as near as chemotherapy backbone plus Trastuzumab. So in these patients, the major pathologic response rate was 53% as compared to 33% in those patients treated with FLOT chemotherapy without Trastuzumab. One treatment arm, the treatment arm with the double antibody combination, Trastuzumab and Pertuzumab, was associated with significant GI toxicity, especially diarrhea, as well as neutropenia, and probably due to this toxicity, it was impossible to administer the full dose of chemotherapy, and this is probably the reason why there was no advantage in neither in pathologic response rate nor in other outcomes. So the double antibody combination cannot be recommended from the data of our trial. But what we could see is that those patients in whom a major pathological response was observed, they have a significant benefit, which is very statistically significant in both relapse-free survival and overall survival as compared to those patients who have no pathologic response. And unfortunately, the overall and progression-free survival in our trial did not show significant differences between the trial arm because the trial was underpowered and results were immature. Nevertheless, in consideration of the higher response rate we observed, which is, in my view, clearly clinically meaningful, especially in the patients treated with FLOT plus Trastuzumab, the addition of Trastuzumab to HER2 positive, localized and locally advanced gastric cancer is something which merits consideration, especially if patients have large tumors and need downsizing to be able to undergo surgical resection. Thank you for your attention.